And actually, that makes total sense.
Yeah.
Because I know me.
And you don't have to understand my boundaries to respect them.
Well, no, I'm the president and co-founder of McShin, a personal and long-term recovery from substance use disorder.
And okay, I gotta work on that.
Celebrating my 6 months. Didn't have a cake.
Yeah.
Gosh, you scared me.
Hey, good afternoon, everybody, and welcome to another episode of the award-winning recovery podcast, Get in the Herd. I am your host, Nathan Mitchell, and today we are with Stephen Wade. And I know some of y'all will be like, who the heck is Stephen Wade, right? And you'd be right to say that.
Good question. Good question,
right? Because most of the time it's who the heck is Nathan Mitchell. But what I like is because I did a little research this morning about this Mr. Wade here. You know, I love what you're doing, substance use disorder, and especially as it's working with families and children that are affected by it. You have a master's degree in urban planning. And I think that urban and environmental planning, is that what it is?
Yep.
From UVA?
Yep, from UVA. Yep.
You kind of in another life, I have in another plane. That's where my focus is.
Oh man, I wish we were on that plane. That would have been fun.
Well, it's not to say it won't happen in the future. I looked at that and went, man, I've been thinking about, taking something new on because, why not? And I was looking at that and thinking this, I'm the guy who loved to play with Legos and build cities and towns.
Sim City.
Oh God, I love Sim City. Yeah. I loved Civilization too, but I wasn't out there destroying things. I was out there building them. So Steven, are you there? All right.
I am here. Yeah, it's jumping a little bit, but I think we're all good.
I think we're all good. Welcome to the show, my friend. Who are you?
Hey, thanks so much for having me. I'm thrilled to be here. I'm Stephen Wade, sitting in my living room today, but I'm an employee of the Virginia Department of Social Services, the Health Equity Project Manager. I'm working at the state to help make our child welfare benefits program system more supportive of people in recovery or people dealing with treatment issues and things like that. So I'm really psyched to be here and talk about the work we're trying to do and just support all the good work you're getting out there.
Yeah, I appreciate that. And so I love how we were introduced. I got a wild hair at my ass about something, and I hit up, I guess he's now Commissioner Danny Avila. Is that his title, Commissioner? Over there. Anyway, so Virginia Department of Health. And I said, look, I'm looking for some information about nalox boxes and putting those into, facilities. Who's working on this? How can we get this done? And he said, well, you need to talk to Stephen Wade. And then, Stephen, you put me in touch with Charlie. And he was on the show 2 weeks ago, I think.
Oh, great.
Yeah. That was a lot of fun. Charlie's a hoot. What I didn't realize about Charlie at the time, and here I'm going to go off on a tangent for a second. What I didn't realize about Charlie at that time was that Charlie is on the document that put together the recommendations that came out of Danny's law. So, I didn't realize that. I was looking at the 14-page recommendations the other day, and I'm like, oh, Charlie Tarsi. I'm like, I know this guy. I just had him on the show. Damn it, I would have talked about that. But so we'll have to get him back on. But listen, we got you on the show today, and you've been heading up a group or part of a group that's get together every other Tuesday. I've been able to get in a few times. It's a bad time for me, a bad time of the day for me, but I try to get to that meeting. Tell me, man, what's going on with that? What's the whole point of you guys getting together and talking about substance use disorder?
Yeah. Thanks for putting that out there. And yeah, I'll just say briefly. I work for the Virginia Department of Social Services. Many of you out there who are listening and watching have probably encountered your local office of or Department of Social Services. We are a part of them, but we are also separate from them. So when you talk to your local office, that's different from the state. We offer some kind of guidance and oversight. And also, I don't speak for the Virginia Department of Social Services. Today, you're going to hear Stephen riffing on various things. We have, as you know, there's been a real growth in attention around the evolving crisis we're experiencing. It's had many manifestations, and at the state level, I think.
Oh no, Stephen. Oh, Steven, we've had a little hiccup there. Are you there?
Can you hear me? It keeps cutting out a little bit, but I think you can
Yeah,
still hear me.
we had a bit of a hiccup there.
Okay. So we have built, and not to be too governmentese, but an interagency group. We have people, as we've come to understand the overdose crisis, but also just the challenges around treatment and recovery touch so many of our systems, and how they touch them is different. So whether you're someone who works for the Medicaid agency, you have certain challenges there. Whether you work for the Department of Behavioral Health, the Virginia Hospital Association, and then myself with the Department of Social Services, I particularly work with families, moms, parents, families dealing with child welfare or benefits issues. And so those issues around treatment and recovery are going to be slightly different, but related to what's being dealt with.
Yeah. Oh no. Related to what's being dealt with. Stephen, we lost you there for a second. Oh, this is yeah. There.
Yeah.
You're back. Are you back?
Okay,
Okay, so you issues
I could walk
related-
somewhere else too. I don't know if it's internet on my end or your end.
I don't know. Well, we're hardwired. Yeah.
I'll walk somewhere closer. Sorry about that.
That's okay. Well, so you were talking a little bit. You were talking about families, and that's when you got cut off. I wish I had the exact sentence you were on, but
Yeah, and so we, a big part of the kind of unique need and skill that we bring is working with families and moms and dads in particular, but really recognizing that treatment, recovery, if you're a parent, has different needs. You've got to figure out a place for your kid to stay while you're in treatment and recovery. You've got to figure out what their childcare and schooling options are. And from our perspective, we want to make sure that the kids are safe too. And so those are the kind of perspectives that are just a little bit more nuanced. And so when we able to have a conversation with Medicaid partners, behavioral health partners, we can build on the successes they have, but then add other nuances around things like family and childcare and things like that.
well, I'm so glad that you're bringing this up, and this is what you're focusing on, because that's something that it's easy to observe around here. We've got a recovery community organization with 15 houses, and many people who are struggling to get through, or just coming out of the criminal justice system, or still mired in it, and and certainly just coming to recovery, and all the family issues that are compounding that, with kids and parents and all those things that happen. What are you finding to be, I guess, the biggest challenges, and where are you finding perhaps the greatest successes in the work that you're doing?
Yeah, that's a really great question. I mean, one of my real focuses as a state employee is really, especially because the space around substance use has really changed nationally and locally in terms of both the challenges people are facing, as well as how we respond to them and how we support people. And so a big part of what I'm doing is education and culture change within both the state office, but also supporting the local offices. Because frankly, we have a lot of frontline workers who are working their tails off, but aren't necessarily experts in necessarily substance use or experts in intimate partner violence. And so a big part of what I do is say, there's this fabulous recovery community organization in your city. Do you know about them? Are you connected to them? Do you have the proper language and tools to talk with the people you're working with who are dealing with, these challenges? And so I think one of the biggest challenges is both understanding what the substance use challenges in Bristol versus Arlington versus Roanoke versus Richmond, what the challenges is in each of those communities, but then also what are the gaps in services in those specific communities. One community might have a really strong, VAR house. One community might have a really great health center, hospital, but there's oftentimes a gap. And a lot of times those gaps occur with families, as you know, people of color, people who don't speak English, a lot of people that come through DSS's doors. So I think getting our culture kind of in the most forward thinking, harm reductionist perspective that we can get to, I think is one of the real challenges. But I think I've seen, one group that we work with a bunch that I think is doing really fantastic work out of the Williamsburg area is called Spirit Works Foundation. Jan Brown, a real leader in this field, is just putting out now a peer recovery specialist training for parents and pregnant people. And so growing this cohort of people that have lived experience of not only substance use, but also being pregnant, but also potentially having a child welfare challenge. How can they bring some of that experience back into the system to support people in their recovery? So I think we have both kind of institutions, some organizations like Spirit Works that are doing fantastic work, and then in a lot of these communities, that, as you surely know, there are moms who were there who are supporting other moms, that are dealing with substance use, that are dealing with pregnancy, that frankly they might not have the institutional support in their specific community, but they have a little moms network from La Leche League or whatever group it might be, school. So I think there are some really exciting kind of community-based opportunities that I really am hoping to kind of build on and support as much as we can.
I love that. And I know that we've struggled here with the idea of how can we better support the parents who are who are here and the children. And so there is definitely a need for recovery housing that is both supportive of family, the parent and the child. And I say the parent and the child because I know a lot of guys who don't have the mother in the life of the children that they're raising. So
exactly.
It's definitely a need, and I'm really happy to hear that about Reverend Brown at Spirit Works doing that work. I knew she was cooking something up, and I'm happy to hear that that's going through. I've found, you talk about peers, and I love the work that you do with the hub, and we'll get to that in a second. But I've found with the peer recovery specialist training here in Virginia that the people who put that together, DBHTS, who sort of oversee the peers and do the certifications for that, have been very responsive and adaptive when we've approached them. The group that I belong to, Virginia Recovery Advocacy Project, we sort of looked at that a few years ago and said, hey, there are 3 paragraphs in this entire giant book that deal with cultural competency. 3. And it's like, maybe we should think about how we can update that. Now, so they're looking at that. They're definitely going to do some work to change that. And I like that. Reverend Brown. There's a real collaborative effort. It seems what I feel like, and my experience is just in Virginia, and my experience with recovery is just in Virginia. But there seems to be real collaborative efforts with boots on the ground people with that lived experience, and the government people who are realizing that things can get done faster sometimes or better sometimes by letting go. So anyway, that's my
and I think you're right, and that's something that really excites me, that there is kind of a growing.
I hear you. You're there. There's a growing. Are you there? Oh no, Stephen, I can see you and hear you. Can you hear me?
Yep, I can hear you. Yep.
Oh, okay.
No, I think you're totally right. That's something that really excites me too, that I think we have some really strong organizations that are growing, from Peter's Place here in Richmond. I think Sarah's doing great work to support. And I think the more and more we can think about, and again, I think one thing about peers is you have this lived experience of substance use, which is obviously kind of one of the critical pieces of it. But as we kind of peel back the onion, we're going to have, there's more types of lived experiences that are really valuable. Whether it's people who are formerly incarcerated, can probably help someone else who's formerly incarcerated navigate. Oh,
yeah, absolutely.
You're still there.
Yeah.
And so I'm really excited about those opportunities and thinking about, the intersection of peer recovery specialists with people who are immigrants or new to Virginia, people who are in recovery, but also, again, have child welfare experience. And so I think all those things are providing opportunities for us to think even more broadly and with more nuance about the kind of recovery space.
It's great to hear that. Yeah. You talking about all this, and I brought it up a minute ago. You have this hub of SUD Ally support. What is it called? The substance use, the SUD Ally. Oh, I don't have it down here on this little piece of paper, but you've got a hub of information for people who are in recovery, or I'm sorry, who want to be recovery allies. Are you there? Oh, perfect. Okay. Who want to be recovery allies, and you have all this information. Where did that come from? Uh-oh.
All right, I'm still here. Start that question again with the hub, please.
Sorry, I think I kind of rambled a little bit about that. So let's talk about the hub. What is the hub, and where did that come from?
Yeah, that's a great question. As I said, I've only been with state government a couple years now, so I kind of jumped in midstream after a lot of people had already been doing a lot of great work. And so a part of, as I talked about, wanting to kind of do some culture change work, do some education work within our DSS offices, but also I'm someone with my background in affordable housing and community development and public health, really know that our community partners are really essential pieces of this. So I really wanted to create a public facing resource where people could identify, could access kind of best practices, particularly related to kind of DSS related issues. I felt like there was a lot of things out there in the clinical space. There was more and more stuff out there in kind of the school space, but there hadn't been a lot of clear work coming out of the kind of human services, social services, and recovery space. And so, as we know, Tom Bannard and Jan Brown at VCU Rams in Recovery have this really fantastic Recovery Ally training that I think, for a lot of people, frankly, in Virginia and around the country, there's a lot of new information there that we didn't know before, and that I think really goes a long way to behavior change, policy change, practice change. And so I partnered with them. I found some resources, brought them on board, and we have incorporated the Recovery Ally training that they do into our world. And I've been delivering the Recovery Ally training to hundreds of DSS workers around the state. And we also added a couple additional elements within that for, again, a little bit more of the DSS worker audience, but a little bit about how our DSS staff can navigate substance use services at their local CSB, how they can incorporate people with lived experience, and what peer recovery specialists are. There's a number of interviews on there with Peter's Place, with we have a peer recovery specialist who works at the Fairfax DSS. He's interviewed in there. So it's a bunch of interviews. It's a bunch of trainings that can be done a la carte. People can do all their own, but my staff actively delivers. We oftentimes will deliver a Recovery Ally training to a local office, and then we'll follow it up with, all right, let's talk about your practices, your recovery community here in whatever city you're in. What are the challenges you're dealing with? How can we help you adjust your policy, find better data, apply for a grant, partner with the RCO? And so we're kind of like a little capacity building technical assistance shop for, frankly, our stretched, very thin staffs all over the state, dealing with people who are, frankly, in crisis during this pandemic and things like that. So I encourage everyone to go check it out. We've made it public, recoveryallyvdss.com. That's recoveryallyvdss.com. You can watch the whole hour training with Tom and Jan, which, frankly, if you haven't done, is fantastic. But you can also do it in pieces. There's great interviews on there. Please get on there. You can sign up for our newsletter. It's a site I'm pretty proud of. It's got a lot of good stuff on there. I've had some staff that's very academic, and so they do a little bit of history of peer recovery specialists and where that kind of movement came from. We do a little bit about kind of equity issues, which should be talked about more. So it's a very exciting place that I'm very proud of.
Art's gonna put the link, scroll it in a second as soon as he finds it real quick. But
yeah, what was it again?
It's recoveryally.vdss.com. recoveryally.vdss.com. And you'll see there's a YouTube video of Stephen right there below the fold, as it were.
Recovery Allied.
It sounds like it. SUD Recovery Ally, ALLY.
Yep. ALLYVDSS.com.
I meant to send him the link in advance, but I've been a little bit of a slacker lately, getting my short-termers disease out of here. But following up on what you're talking about here in the hub and working with Tom Bannard and Jan Brown and putting all this together, that's some really great stuff, man. How is it being received by the people taking it? What's the feedback? That's
a good question. I wasn't sure. My background is in affordable housing, in building, safe communities, healthy communities, public health questions, and so frankly, the recovery space is relatively new to me within the last few years, and so I didn't know. I've never been a frontline social worker in Virginia, and frankly, I've been really, really pleased. I think there has been, people who go into social work. I'm not a social worker, but we'll talk about them. People go into social work really want to do well for people. They really want to do right, and so I found that there's, frankly, a really big hunger for this kind of stuff. I think there's been. It seems like there's been a little bit of a vacuum in the kind of education and knowledge building space around substance use. As you know, as we're shifting into more of a kind of harm reduction space, more of a kind of safe supply kind of space, that people have been really, really responsive. I think, frankly, a lot of our local staffs are really frustrated with not always having good answers for people. And so a big part of what I do is in these trainings is provide them with some basic tools to help make their jobs hopefully a little bit easier. And then again, it's about, social workers are not clinicians. And so often what happens is a DSS office, someone comes in, they get screened for whatever issues they may have, say it's a substance use issue, and then the treatment or whatever will go over to the CSB or some private provider. And so, you hope in that jurisdiction that the service exists. You hope there's not a 3-month wait list. You hope it's the type of service that helps that person. But as I'm sure you understand from the just kind of complexity of our treatment and recovery system, that depending on where you are, depending on your identity, depending on your insurance, those are going to be stronger in other places. So I think I've been really pleased at how hungry people are for wanting to know basic stuff like the right language and honestly a place where they can ask what they think are dumb questions. But as we know, there aren't really dumb questions in this space. I don't know that much about drugs. I haven't used that many drugs. I don't, so like but we need to have a space where we can say, I think I saw this drug. What does it do? What do I need to know about it? And, I think a big part of it too is letting people realize there's not always a simple answer. And we're going to have to figure out, as an agency that's focused on child safety and focused on keeping families together, we have to be careful. But how do we create an environment and a place where our staff and our systems can be comfortable with something that isn't the way it's always been, or comfortable with an environment that they're not necessarily potentially familiar with? And so it's this process of building as we talk about with recovery, a return to reuse is a part of recovery. And depending on the substance use and depending on the age, there's all different kinds of ramifications for parenting, for housing quality. And so I think, and then as I've kind of alluded to as a planner, a big part of what I do, I have a good knowledge of, and I really value a community, the housing in the community, the transportation in the community, the job opportunities in the community. And so we know that when someone is thinking about recovery or not in recovery, that these kind of recovery capital elements are so critical. And the social worker is not going to be able to create a whole stream for them. But the more I can help them navigate and think about, how can we get this person's housing a little more solid while they're dealing with this issue, and think about the transportation to get to that new job they might get and the challenges they might face there. And so I think honestly, having a space where we can have these complicated conversations, I think has been really, really valuable. So there's a lot of work left to do. It's an uphill battle. I will not kid you on that. But I do think so many people have been so badly hurt by this that it has really resonated with people about, and frankly, I cannot, as you know too, how many people I talk to, staff and otherwise, who are like, my brother, my cousin, my sister, my aunt, my uncle, my dad, my brother. I mean, just we've all been touched. We've all been touched. And so the opportunity around that, I think, while depressing, is really exciting.
Yeah, I can appreciate that. So for art, recoveryally.vdss.gov or .com.
.com.
Yeah. So art, you had the right site.
You did.
The link turns into that link.
It
But,
does. It
yeah.
gets
So
all that way.
Oh, okay.
Yeah.
Got you.
Yeah. Yeah. There we go. So this is the
There
site
we
right
go.
here.
Yep.
You scroll down. There's Happy Steve.
Ah, there's me. There's me.
By the way, that is that beard, man. That is that's substantial.
Pandemic and parenting just does, I tell people like it both kind of reflects how I'm feeling on the inside, and with little kids, it's kind of the only thing I have any control over anymore. So I put a lot into it.
That actually sounds like a book. Pandemic parenting. Pandemic parenting.
It's a real thing. It's a real thing.
Yeah. So Art's going to scroll that down at the bottom. We'll put it in the comments too, man, because I love the resource, and I barely started looking at it. Not even scratching the surface at it, but I can see how this training would absolutely not only benefit your DSS employees, and certainly I know why Tom and Reverend Brown would do that and put that together. I can see that being a real helpful tool for the parents and the family members as well of people who are struggling with it. We have a pretty robust family oriented group around here for family members of our individuals who are, because it's important. It's very important to continue those connections. And many of our participants are younger. Although we do have actually some older participants who have their children who attend these family groups that we do here. But this
Awesome.
tool is something I'm going to point out. I'm going to share this with our people here who do the family groups, because I see the value in this. Just as I'm scratching the surface on it, I'm like, oh man, there's so many dynamics to the work that you're doing, because I reached out to you with the idea that, hey, the locks boxes, and so you put me in a Charlie, and we kind of came up with some ideas, and we're installing a one box, which is similar. It's in the locks box.
Oh, that's great.
We're installing one on the 16th of September. So I don't know if that's
We got it.
Did we?
Did we? I didn't know. You said we were installing it.
Oh no, we haven't gotten it yet. They're bringing it.
I didn't even know they
Mobilize.
approved it. Yeah. Oh,
well, we're just doing it.
Oh, okay, yeah, there you go.
Well, so there's a look. Maybe I shouldn't be talking. Maybe I'm talking out of term here, but it sort of actually brings.
I'm still here.
No. I mean, I'm talking out of term because I'm sort of starting early and saying, oh shoot, maybe I've said more than I was supposed to say. But the reality is, I mean, like, we should be able to talk about naloxone. We should be able to leave that out. We should be able to have that available to anybody. And the more I talk about these things, the more I get mad, actually, that these things aren't accessible. But then adding a whole nother layer, because I'm a person who came to recovery 4.5 years ago, and coming to recovery, before I got into recovery, it wasn't my problem. It was your problem and your problem.
Totally.
Yeah. And even as I started to get into recovery, it was, all right, well, maybe some of this is my fault, but, still, oh, well, mommy and daddy didn't love me enough. And, oh, this guy died of it. All the things that, I'm saying is my problem. And so learning the language of acceptance, meaning that, I'm the problem, right? I have the answers to my problems. It means, that I've had sort of an epiphany over the last 2 years since the pandemic has started on what harm reduction means. Early on in recovery, I thought this was an enabling thing. I'm like, all right, well, that's nice and all. And yeah, we don't want people dying, but, really we're just enabling bad behavior. And even as I got into recovery, the idea of the abstinent ideal, which that's a whole discussion on what does abstinence actually look like and mean, but that's way beyond the scope of what I would love to talk about today. For what I love, though, is that harm reduction and the idea of what recovery is has definitely changed for me. And meeting people where they're at, which I don't like that term, but actually getting down and helping people where we can. And so I know that you're really into that space, and I kind of wonder, because you come from a housing background, And actually I want to talk more about that, but maybe off. I love the idea of tiny houses and a community of tiny houses for people.
Oh, don't get me started on tiny houses. All right.
Wait, is that a good thing or a bad thing? You like them or you don't like them?
It depends how it's done.
All right. We're going to have that conversation then. But let's talk about harm reduction. Let's talk about what we need to do. What do you think we need to do?
Yeah. It's a really good question. And I think, and I think actually the kind of family elements you were.
Yeah.
You guys still there?
Yeah, well, we're here. Oh, no. Well, we can see you and you're moving around just fine.
Sorry, I'm really sorry about my internet.
That's all right.
Okay, well then I'll just keep going. I think your framework about family is really useful and insightful. I mean, I've recently had a really great training by Paul Brassler, a local awesome clinician, around family dynamics and how family dynamics play into someone's substance use, but as well as their recovery and different roles people play. But within DSS and particularly the child welfare space, I think there's more and more action around, we really do think that families know best. People know best about themselves, about what they need. The most effective solutions are probably oftentimes ones that are closest by. And so that has also taken some change within kind of this work, where it used to be the outside expert comes in and solves the problem, and this is what you do, and here are the rules. But so much more now is about, you have these assets and strengths in this home or in this neighborhood or in this community or in this extended family or in this church. How can they wrap around here and support? And so that kind of gets me, that's an harm reduction, as has a couple different definitions. There's the certified harm reduction sites, which are a thing from the health department. There's capital H, capital R, the harm reduction movement, kind of a kind of liberatory LGBTQ political movement, all of which I find really exciting. And I think, briefly on the naloxone front, there are laws, I think, that are keeping naloxone from being like in our DSS offices, which that's something we've talked about and I want to keep working on. But I also am really excited about the potential of like mail order naloxone. I think that's also kind of not legally possible now because of certain things. But I think particularly for our rural neighbors and for neighbors that don't want their drug use to be known in public, having mail order options is really something I think that would be valuable. So just a brief thing on naloxone, I think, is something that I'm extremely interested in, how we think about kind of reaching people who are, the term traditionally have been hard to reach, but as you know, people who might not want to show up in our offices. But, and from the DSS perspective, or from my perspective, not speaking for DSS, one, as I was talking about, particularly in the child welfare space, traditionally in child welfare, there used to be, in a line with how we treated substance use before, we would basically punish people. We would remove them from society and punish them. And that is often how child welfare would operate too. Out of fear and various things, kids would get removed from families, potentially put in foster care, potentially returned home. That was frankly what was fairly common around the country. That was a normal practice. And now there's been a really big sea change, moving towards, that's not working. How we want families to stay together. And the family to stay together is not going to be, no family's perfect. No family fits some ideal checklist. No family meets every criteria that I define as the perfect family. And so it's not, I think, harm reduction in the normal sense. But if someone's struggling with substance use, in the past, that may have been more of there's still varying practice around the state. There still could be reasons for a child getting removed, but more and more we're talking and thinking and exploring this idea of, you're someone who uses drugs, that you're also a parent. Maybe while you're using substances, there's someone else who can keep an eye on your kid, and that's frankly, that's a radical idea. Something that, well, in Virginia, it's a radical idea. And so thinking and talking about that, understandably, makes everybody a little uncomfortable. But it's the harm reduction of our everyday lives, from wearing a seatbelt to, the things we do, putting on a Band-Aid, whatever. That's thinking about it a little bit from the family perspective, that, getting to, as you talked about earlier, an abstinence only solution here. The next step from that means we'll probably have a lot of children removed from their homes, and that will probably lead to worse outcomes, more expensive outcomes for everybody. And so if we recognize that abstinence is not the only path, and we develop tools and resources of support for families to be safe, and how we define safety, hopefully collaboratively and collectively, we can bring kind of a harm reduction approach, safety first, all those kind of things. But frankly, that's a really big change, and we're not all there. But that's the kind of thing in the harm reduction space that I bring a lot to conversation. We're talking about naloxone, talking about recovery, that, and as we know, not to state the obvious, there are people all over our state using drugs in parenting right now and doing it safely. And so this is something that happens. I think we have models and growing tools for how to get there. But yeah, I think the harm reduction space in general, as can be scary and is a new space. But this is a way that we are beginning to try to think about it. In terms of what you said, meeting people where they're at. If you meet a family and someone in that family is using drugs, that's where they're at. And so if you want to keep the family together, what do we do to make it so it's as safe as possible for everybody, but we can keep the family together? And so I'm not going to pretend that it's easy, but that's something that we are really grappling with. And so the more we can bring people, frankly, and this is again speaking for me, I'm not speaking for VDSS, bring people who have experience using drugs, experience parenting and using drugs, to help us understand this issue and help us understand how to make it safe. What are the childcare needs? What are the house needs? What are the, so frankly, it's a relatively still growing space, but I think I'm interested as lifting these conversations up and having, particularly my partners around state government, realize that when a customer shows up at the CSB, if they're a parent, they might also be dealing with this reality too. And so it's important that my Medicaid partners, my CSB partners, my hospital partners know what I'm talking about, so that they can respond in a way that is sensitive to that kind of context. Does that make sense?
I think it makes a lot of sense, but and I really appreciate that work and what you're talking about, but I want to tack a little bit to the well, maybe to the left. How about that? Tell me, man, what got you into this work? You talked about housing. You have a background as a master's in urban and environmental planning. And now you're doing well. I can see where all this comes together.
Yeah, I think you probably can.
What drives you?
My undergrad degree is in anthropology. Spent a semester abroad in India. Spent a semester abroad in South Africa. My dad did the Peace Corps. My mama did Vista. I've always been interested in how communities and cultures change, how they grow, how they evolve. I didn't grow up as a planning nerd as a kid. I heard about it late in my teenage or my college probably. I was looking for a field that for planning and housing that materially touch people's lives. Bricks and sticks and a roof over someone's house. You can see a material change that has, frankly, a moral element to it, and also has a kind of policy intellectual element to it. So I kind of came to it from, I believe, and I've come to, everybody deserves a safe and healthy, affordable place to live. That's what I had. Across the train tracks in Alexandria, those people didn't have that. And so was deep in the housing field for a while, and then when I was in Southeast Michigan, I started doing a bunch more kind of really focused community engagement work, particularly in communities that were kind of left out. And the health department there, the local health department, which is probably a little more activist-y than the urban planner space, recruited me over to the public health space to help rethink their community health planning. So I work a lot with our health department here in the state, really love their work. And then I was in Michigan, this is probably 10 years ago now, when some of the real overdose things began up there as well. So I kind of started up there. And then it's pretty circuitous how I ended up, but I've always been interested in, I don't love the term vulnerable, but I do think that the way we care for and treat and provide materially to particular populations, whether it's people who use drugs, whether it's low-income people, whether it's people of color, non-English speakers, the way they are materially treated is very important to me, and I think it reflects deeply on who we are. And so I've learned that, and again, like I believe in the community, and so whether I'm working on getting the bus line to be better, or getting the drugs to be safer, or getting the parenting to be easier, whatever part of the community I can build up, particularly for those that have been hurt by our systems, that's the space where I'm interested in. So
we can definitely use better public transit here in
oh
Richmond
my
area.
gosh, oh my
But that's
gosh.
there's another show for you.
No, I mean that's also, why this field of planning, not to go down too far to planning nerd, but it's an exciting, thrilling field, and it's really important. I mean, where we invest and how we invest in transit or not is critically important to so many people. I'm here in Richmond, or around our city. How often your bus runs, whether or not you have sidewalks and crosswalks, whether your kids can play, and then the housing policies around that are just absolutely critical to, frankly, what drives me as well is kind of, you've seen the maps out of VCU's Department of Society and Health that show the difference in life expectancy across like the city of Richmond. And you live on the West End, you get to be 80 some years old as your average, age of death. On the east side of our city, it's down at 60. And so literally these decisions we're making around housing, transportation, schools, our city budgets, rob people of years of their lives, literally. And so to me, that gets me out of bed most mornings and gets me agitated most mornings. And so, and I mean, I do think the recovery space is a really, it's a really exciting one. I think, frankly, the housing world's at a little bit of a loggerheads about how to go forward with the various crises of evictions and various things. But the recovery space is still, we're still learning so much at the moment, and we're not. I don't think we're at our best yet. And so I'm excited about where we're headed in terms of making the recovery world, again, in Bristol, in Abingdon, in Arlington, in Roanoke, and Norfolk, all of them to be strong.
There's such a broad understanding, it seems to me now, that there's a real understanding about lived experience being a really important factor in facilitating and helping others, get into and maintain, long-term recovery, whatever that looks like. So, I'm excited about that too. And I told you what's coming up for me, but before we talk about that, there were a couple comments up there. I think Frank Cordovano, he's gonna be on the show next week. Frank says, great interview. Say hello to Tom from me, please. So I guess he's talking about Tom Bannard.
Yep.
Yeah, and I love Tom too. So Tom and I are sporting the ponytails now.
Just go man bun. Just do it. Just go ahead and do it. Wrap it up.
I do it at home when I'm going to bed because one of the I just kind of throw in a sloppy bun and I'm off to bed. But I just can't do the man bun.
I had
a man bun once upon a time.
Yeah, but you're a millennial. you can't see art, but I can see.
It was weird. It was an awkward phase.
Art's from California. Southern California.
Oh yes.
So that explains a lot. Patrick Jones says, and he put this up here when we were talking about parents and harm reduction and using while parenting.
Yeah.
There's another book.
Yep.
I love this conversation if it's difficult or uncomfortable to talk about, it probably means it needs to be addressed even more. Harm reduction saves lives. You're absolutely right, Patrick. And I think of it, as we were talking or as I was listening to you, I was thinking about, the parents. My parents really didn't do this, but I have friends who parent, and they'll go out, on a Friday, Saturday night with the sole intention to go get wasted. They know they're going to go get wasted.
Of course.
And what do? They get a babysitter for the evening for the kids. They set this all up. I mean, it's planned. Maybe you have a designated driver, or you're going to get an Uber or Lyft or whatever, and this is planned. It's so there's a precedence for this.
There is.
There is a precedence, and somebody was telling me, talking harm reduction again, and talking more broadly, or well, maybe more specifically, getting into the term shooting gallery, but that's not the right. I know that's not a politically correct term, but a safe use space. Where you can go and they're referred to as shooting galleries in some places. Which
that's funny. I haven't heard that term. Yeah.
Oh no! Well, I have heard the term. I don't know if it's.
Like
I don't know.
safe injection site.
Safe injection site or
safe injection site,
consumption site. That's the word. Actually.
Yep.
And I've heard such derision around that term. Those terms. I'll say because we said a bunch of them, but around those terms. But then if you look at it, isn't a bar just a safe consumption site? I mean, seriously, that's not even a joke. But isn't that what it is? Yeah. And so, like, if we turn these things around, and you said seatbelts earlier, which I think is one of the things that smacked me 2 years ago. Is like, we have harm reduction already, and we already know it saves lives.
Yep.
Seatbelts are harm reduction. They save lives. So, very broadly, we know these are things that happen. It's like the more we can get into the, hey, you know what? I'm gonna stop trying to punish and tell you you're a piece of shit. I can say that. Piece of shit. I'm just gonna sit here and try to help you.
Yeah.
And help you facilitate your own journey. And that way, the kids will be safer, eventually. There's well, not eventually, but the kids are safer. The families are safer. Their public safety is better. And when we look at all these things combined, we look at that and realize and put it through a public health disease perspective, because I come from a criminal justice, I found recovery in a criminal justice, in the carceral system, in jail, and our reach here is, primarily the people who are watching us are currently incarcerated, which I love, and everybody, who listens on a regular basis knows that. And at the same time, we'll get people on here. We had Richmond City, Colette McKeechin, we had the Commonwealth's attorney on here way back at the beginning of the pandemic. She was on and talking, and I love Colette, and I live in Richmond City. I supported her last couple campaigns, and but she was on the show. We're talking, and she comes and she supports McShin, and her husband does too. He's well, not the congressman here, but he's a congressman in Richmond City where I am.
Yep.
And she was on the show. We were talking, and she said, Nathan, would you have got into recovery if you hadn't gotten arrested? And my charges, my conviction in Virginia and in DC, because I'm an extra special, got to have charges in different places, are for possession. My a lot of felonious things that I didn't get arrested for in the day. I get that too.
Sure.
When I have the Commonwealth's attorney ask me, would I have found recovery if I hadn't gotten arrested? I said, well, I don't know. But maybe there could be something else that doesn't have life-changing, life-forever consequences here. Because it's not just, okay, yes, you have I don't know how familiar you are with the laws in Virginia, but, you do have this first offender's predisposition that you can the judges can use, and they can use. They're not required to. They're not supposed. They're not. They do, right? But they don't have to, and they can certainly take it away if you continue to use in pretrial and then abscond from pretrial. They might just take that away. By the way, I'm a felon because of that, and it seemed like there has to be some kind of other way that we can do this that doesn't impact not only my life going forward for the rest of my life, but the if I ever have a family and kids, because certainly a felon is going to have a harder time providing for family, for children. Felon's going to have a more difficult time getting schools together and continuing, and so it's a generational problem. So we need to look at generational generational solutions. So I really am inspired by what you're doing. That whole recovery allyship program that you're working on is really, really, really incredible. And I'm going to pass this up the chain or over the chain or whatever, wherever the chain here for our people.
All the chains, yep.
All the chains, yeah. And pass that along because this is really great work that you're doing here. And I'm so glad that I've gotten to meet you. And as you know, I'm leaving the McShin Foundation. I'll still be sitting in the chair here occasionally. We haven't quite worked out how much I'll be able to do that. I want to do it all the time, but I also know I have another job I'm going to. This is the one part of my job I really don't want to let go of because I love doing this. And some of the most fun parts of my job are coming with me to my new job. But I really am inspired by what you're doing. I love that you're looking at peers and lived experience, individuals with lived experience and peers, and in all the different facets of what that means. Family members impacted have an incredible voice and need to be heard too.
Yep, exactly.
And family members, people who have gone through the carceral systems, which is a lot of us here at McShin because we sort of cater. We not intent. There's a lot of intentionality with focusing with that population, just because that's where what we've decided to focus on.
Yep.
But also, coming from an LGBTQIA plus perspective, it's great that we have Peter's Place and Chantel doing that work. It's great that we have Tom and the recovery Rams for Recovery because the collegiate recovery, that stuff's amazing. What he's doing over there is great. So we
it's
have
incredible.
So many fantastic leaders in this space. I have lost my freaking point. Art, are you surprised by that?
No, I'm not actually.
I lost my point.
We'll blame it on the COVID.
We'll blame it on the COVID fog. It's a real thing. Generally, though, I'm really inspired by what you're doing and that focus on the peer, and so and the family. So
that's great. No, I've been really, really thrilled to chat. And as you know, as a housing guy, I've been around the VAR conversations, and I'm excited for you to head over there. And I would love to chat more about that. Particularly about supporting families, getting all over the state. I've got lots of thoughts about, and then as I said, the housing world is in some major challenges right now, from public housing redevelopment to evictions to prices going up. And so, but I know that housing is absolutely a priority for people in recovery. And so, thinking through how VAR can really help people get that stable roof over their head, I think is critical. And so I'm really excited about that conversation.
These are great conversations. And we identified the challenge of, keeping families together through recovery.
Yep.
That's certainly a challenge. And, certainly with housing, especially in early recovery.
Yep.
We see it time and time again. And, I think there is the challenge, I'm going over the time here by going, but there's another challenge of, we were just talking about that this morning. With recovery housing, you can come from a treatment and you can come here and maybe do a 28-day intensive or maybe go right into a step-up housing, which means you can start looking for a job and you're living with guys or gals, you're living with people, and you're sharing the spaces. And I think that's extremely important. That's wonderful.
It is.
And we always recommend at least 9 months. Now, some people launch at 6 or 3. Some people like me, we're extra hard-headed. We need a year and a half or a little more, before we get out and start going. But what would be really helpful, as you're thinking about housing and the space is, all right, recovery housing is great. I don't want to spend my life living in a room with a couple of other people.
No, that is correct.
How do we get this next level recovery housing? And that's something we don't have in this space, which would include the families, and there's my little plug for tiny housing, by the way, because I think it would be really cool to have a whole
community.
That's the word, because that's not what I was thinking, but that is the word.
A tiny recovery community.
A tiny recovery community. For people like me who all right, great. I'm 4.5 years into my recovery, and I rent a couple of bedrooms. I rent a space in a house, and I'm okay. But I'd like a little more. I have freedom because I don't live in recovery housing, but it'd be nice to have my own little space. I'm single. I don't need much. Two guys, if I got married, 2 of us, we don't need much space, but it's so prohibitively expensive, and I'm a felon.
It is.
It's
yes.
just
Oh my gosh. Your options are so limited. Correct.
But that's me, and I'm
No, that's all really good stuff. And I think, just briefly on the housing side, I think, as I'm sure you're familiar with, a decent amount is kind of the whole housing first perspective about that's people more who are struggling with homelessness and things like that. But, it's such a key thing to get people in stable long-term housing as quickly as possible. And so building that pipeline of everything from the land, the zoning, the funding, to then you get the beds and the apartments. It's an incredibly difficult process, but how do we get people in stable housing quickly is something that I'm glad we got a few of us working on it.
I would love to have another conversation with you in the future, especially diving into housing first, and because that intersectionality with mental health, substance use disorder. I mean, it's just the intersectionality is huge there.
It is. It is. Health and housing have made a lot of really tight partnerships in the last couple of years, and frankly, we have a bunch of good housing brains in the state of Virginia that are doing some really good thinking about this work. But we are up against some major challenges. So
we will leave that conversation for another day. But I think I might leave us today and go buy some Lego bricks.
There you go. Just build the sidewalks too. Build the sidewalks. All right.
Always build the sidewalks. Always build the sidewalks. Yeah, man. Stephen, I really appreciate you being here today. Do you have anything else you want to share with us before we say goodnight?
No, that's it. Just keep up the good work, and people can find me on that website. Reach out if they want to chat on the side. I'm always happy to chat. So I appreciate being part of this community.
Yeah, appreciate you and your allyship. Art, you got anything you want to say to the bye?
No, thanks for coming on the show. Appreciate all the work you do.
Same, Art.
But we've made a real strategic, total tangent here, but we've made a strategic error in the way we've done this today. Because you're looking at my face, but really, Art over there with that fresh, clean shave.
Oh
trim.
man!
Now he's Art's going to be taking over some of the hosting duties when I leave, so I'm trying to make sure I build him up a little bit because he's very nervous about this.
Yeah.
And the problem is he's such a natural with other people, and he doesn't realize it. So man, we need to have another camera facing just on you.
Looking for sponsors.
Looking for sponsors.
You want to sponsor the face?
Oh, there we go. You'll make more money than I will. But Steven, appreciate you. Go take care of those little kids that you got.
I'll try.
Yeah. Thank you, everybody out there watching, listening. We will see you back tomorrow for Women Wednesday. Who's in the chair tomorrow?
Women Wednesday, we have Monique hosting and Mandy Brando will be on.
Woo! All right. So listen, Steven, Mandy runs our judicial programs. So she's actually in Richmond City Jail. I'll be there tomorrow afternoon, actually. We go in and we do, substance use disorder related recovery programming in the jail. So she goes in there in Pamunkey. We have a program up in RSW, up in Fort William, Front Royal. Fort William, that's in Scotland. But anyway, that's a good show. So y'all tune in tomorrow for Monique and Mandy. I'm going to get off the show now. Hey, everybody. Thanks for being here. Take care. Stay in the herd. Bye now.